On the Health Watch today, May is Skin Cancer Awareness Month, and here in Florida, we pretty much know the common signs. We hear it all the time. But did you know some types are nearly invisible? They can look clear, they look flat, they look like a waxy scar. They hide under the skin or under a fingernail. That's tough to find, too. Dr. Matthew Knight is here. He's the president of Knight Dermatology Institute. Doc, always great to see you. Appreciate you being here today.
Awesome. Thanks for having me.
Okay, so here on the morning show, we're open books. You know, we talk about our health issues all the time. So I bring this up personally because you guys caught this. I have one on my chest right now. Never saw it. Never, I mean, no indication. There's nothing there. And yet your staff caught it. How do you find what are called invisible skin cancers?
Right, it's really hard.
I never would have seen this at all.
Yeah, that's the problem with skin cancer. It doesn't always read the book. People expect that they're going to have this really dark mole or this thing that's bleeding on their pillow and doesn't go away. But as you learned, that's not always the case. And so the art of dermatology is seeing this stuff over and over and over again, and it's just pattern recognition. It's like if you're a radiologist and you look at x-rays all day long, you see patterns emerge.
Right.
But as a dermatologist, same thing, very visual, you're seeing this stuff emerge. And it's so important here in Central Florida. This is the epicenter for skin cancer in our country. You know, one person dies of melanoma every hour in this country. People like Dick Vitale going through a bad melanoma battle. Jimmy Buffett died of skin cancer. So it's so important that if you have something that's growing or changing or looking weird, that you get in and get your skin checked.
Okay, so these right here that we're looking at, Doc, now that's not one of the invisible ones here, but somebody sees it looks like a little, I don't know, like a bruise on the left-hand side, but that's cancer.
It happens all the time. So it can look like a little scar, it can look like a little pink area. I mean, I've had friends of mine come in with melanoma that look like a little skin tag. We call that amelanotic melanoma. That's the kind of thing that keeps dermatologists up at night.
Wow.
But skin cancer doesn't always have to have that. You know, we teach people the ABCDs of melanoma, so it looks like this jagged, kind of dark thing. But as that photo shows, it doesn't always have to look that way. It can look like a little pink streak and be basal cell carcinoma.
Are there others that fool people where you think it's just a freckle and all of a sudden, no, it's much more?
All the time, all the time. And that's why if you have something that's changing or something just looks weird or off, I'll tell you, we're forever having barbers, beauticians, massage therapists send us patients because they found something in a scalp or behind the leg or in an area where you don't really look that often. So if you notice something changing or something seems off, going to your derm's like going to the dentist. It's super easy, right? Just show up, get your skin checked, and the deal is it can save a life. If you find a melanoma early, stage 0, which thank God almost all the melanomas we detect are stage 0, it's 100% curable with surgery. It's when you wait. It's like 2 to 3 years of waiting. That's when the problem arises.
I'm going to set this next question up with back to mine. So you guys gave me a chemotherapy cream, right? That's how it's got a name, but it's a chemotherapy cream. I'm supposed to put it on something. I don't even know if I'm putting it on the right spot because I still can't see anything.
Right.
We talk about warning signs. What are the warning signs we need to look out for then?
Yeah, part of the problem is, you know, it's good when cancer's really early, you can use things like creams sometimes instead of having to go to surgery. But the problem is if people know they get red all over, and so they start putting the cream all over and they get this really bad reaction, which is what you're talking about. So in these cases, we like to take pictures on cell phones and say, you know, it was right here, because it's all predicated on a biopsy, right? If something looks funny, you do a skin biopsy. A pathologist looks at the cells under the microscope, these tiny, tiny little cells, and that's how you diagnose skin cancer. And so it can be hard with the naked eye, especially in basal cell, to say it's right here, exactly your point. But an even better reason to use creams, because if you can melt it away with a cream, it's often better than doing surgery, which will take you out of the game. You can't play golf and stuff.
Right, and that's that's why you have the cream, which is great, because otherwise I get the cut and I'm out for what, 6 weeks?
It's a couple weeks, you know,
that's
usually.
Not happen, so thanks for the cream.
Well, it's the golf capital of the world, right?
Right. So
we're constantly battling that. You don't want to tell somebody they can't play golf for 2 weeks here in Orlando, Florida.
Right, exactly. Okay, very quickly, how do you protect yourself? I know you got some things here. Let's go through these very quickly.
Yeah, just real quick. I mean, people are doing so much better. I see people on the golf course with the long sleeve shirts. Skin cancer is related to too much sun 20, 30 years ago, right? It's like smoking, right? You don't get lung cancer a day after smoking a cigarette. You get skin cancer 20, 30 years after getting too much sun. If you look like me and you're really fair skinned, I'm the kind of person that gets skin cancer. So if you have a family history of skin cancer, if you're super fair skinned, you grew up here like I did, right? You got a lot of sun. If you're a sportsman or you play a lot of golf, you're at a higher risk category.
These are what you were talking about.
But yeah. I'm talking
They're
about
real thin,
like,
but they do keep it okay.
Yeah, well, it's like walking into Chernobyl, right? You wouldn't do that without a hazmat suit on.
Right.
So this is just radiation, and you've got to protect yourself from radiation. All sun is not bad. bad, but too much sun causes DNA mutations 20, 30 years later.
Okay.
So parents are doing a much better job of hats, UV 400 glasses,
everybody's doing this
zinc
now.
oxide
Yep.
sunscreen,
Everybody's
cover-ups. Like I was saying, I love it. I see people playing tennis with those arm sleeves.
Yeah.
That is so great.
Yeah.
The best way to protect yourself is to cover up.
All right, leave it at that. Dr. Matthew Knight, appreciate you coming in today. Always great to see you on
Awesome.
the Fridays. All right, again, president of Knight Dermatology Institute. Let's talk with Jess, find out how much sun we're going to be seeing here, because I assume we're going to need the sunscreen.
Yeah, definitely want to make